Welcome to XRA Medical Imaging. Hi, I'm Joan. I'm the director at XRA Medical Imaging. We're here today to give you a tour of our facility, to show you the modalities that we perform here at XRA, and to demonstrate some of our safety practices. You're standing in one of our 3 waiting areas that we have within the facility. We have removed our patient education magazines as well as some amenities that we used to provide due to COVID. However, we've maintained our patient notifications such as our diagnostic Department of Health registration, our patient rights posters, our ACR certificates, our patient complaint lines, and the process to do that, as well as our Image Gently and Image Wisely brochures. We've put the screening desks in place since the beginning of COVID. Everyone who walks through our doors is screened. At the moment they arrive, we screen our patients, we screen our vendors as well as our employees on a daily basis. We update the information on the sheet from the Rhode Island Department of Health every week. And now the rest of my staff will be happy to give you a tour of the facility as well as a normal patient experience here at XRA Medical Imaging. Thank you.
Hello. Hi. I'm here for an appointment today.
Oh, okay. Could I please have your name?
Sure, Lenore Dewar,
Your date of birth?
2967.
Appointment, do you mind if I took your temperature?
Sure, go ahead.
Have you taken any Tylenol or Advil in the last 24 hours for a fever?
No.
Do you have a cough?
No.
Sore throat?
No.
Shortness of breath?
No.
Difficulty breathing?
No.
Chills?
No.
Loss of taste?
No.
Smell?
No.
Have you been exposed to someone under investigation for COVID within the last 10 days?
I have not.
Have you traveled outside of Rhode Island in the last 14 days?
No.
Okay, it's not applicable. Have you traveled outside the country in the last 14 days?
I have not.
Okay, you're all set to sit down. Please take a seat where there's no patients.
Thank you.
Thank you.
Hello.
How are you?
I'm good. How are you?
Good, thank you. All right, so we're checking you in for your appointment today.
Yes.
No changes to the address or phone number?
No, it's the same.
Okay, insurance is still under Tufts?
It is.
Okay, and results, as far as the results, would you like them to go to any other physician?
No.
Okay, would you like a copy yourself?
I would like a copy of just the report.
Okay, so for that, we do have the authorization to email form.
Okay.
We just need you to sign and date there so that we can email it for you. You can just hold on to that pen. I'll have one more for you to sign.
Okay.
Okay, and then we just need to know, have you or will you be getting the COVID-19 vaccine?
I am scheduled to get it, but I have not gotten it yet.
Okay. All right, so the reason why we asked is just because it has been known that enlarged lymph nodes may appear.
Okay.
And so we're just following the Society of Breast Imaging, just making sure that we book it 6 weeks out after the 2nd dose.
Okay, very good. Thank you.
You're welcome. All right, and then just one more form for you to sign. This is just your information that I reviewed with you. There were no changes. So just another signature and date. And then when you're all set with that, the pen can go in the dirty cup. Okay, and then you are all set. They'll be out for you shortly.
All right, thank you.
Thank you.
Perfect. Lenore?
I'm gonna go up and explain to her why she's gonna upload that CD.
Hello. My name is Stacy. I'm going to be doing your exam today. Just going to have you get okay. Okay. You're gonna go right in this dressing room. Can you just verify your last name and date of birth?
Do I?
UARTE 1967. Okay, and you see Dr. DiCenzo?
I do.
Okay. And you're here for a screening mammogram today?
Yes.
Any family history of any breast cancer?
No.
Any surgeries or procedures to your breast?
No.
Are you on any hormones, anything that would contain estrogen or progesterone?
No.
Do you have on any perfume, powder, or deodorant?
I do not.
And have you had the COVID vaccine?
I have not had it yet.
Okay.
I'm scheduled to have it.
Okay. We only ask because the vaccine can alter the results for your mammography. So if you had either of those, we would have you reschedule out. So you're good to go for today. What we're going to do, we're going to take 2 pictures on each side.
Okay.
Your breast is going to be in compression for about 30 seconds. During that time, you can breathe normally. And this arm is going to move back and forth. We have a 3D machine. So that movement is just going to create a 3D image of your breast.
Okay.
Okay? Your results will go to Dr. DiCenzo. We'll fax those over. We will also mail you a letter. So you'll get something from XRA. It'll give you your results of your exam. It'll also let you know a little bit about your breast tissue, just for your knowledge.
Okay.
Would you like your exam to be sent to any other doctor?
No,
And-
that's fine.
And do you need a copy of any images or CDs for yourself?
I do not.
Okay. Alright, so this is one of our handicap accessible dressing rooms. We have a pull cord, a pregnancy notification sign, strobe light, and a sprinkler as well. That's probably it.
If you're wearing a watch, just take your watch off.
And can you just verify your last name and date of birth?
Tamar, DARTE 1967.
All right. Any chance of pregnancy?
No.
Do you know the date of your last menstrual period? In week-wise is okay.
It was last week.
Okay. I'm just gonna get set up back here. So this is our sponges, our lead shields, and this is our control area. We have technique charts, safety rules. This is our reading station and our cassettes here. And that's it.
Hi, my name is Linda. I'm the lead ultrasound tech at XRA Medical Imaging. This is our ultrasound suite. This suite is a representative of all the suites at our other sites. This is our workstation area. Our work list is on this desktop. We start our patients, we bring them into the room, we introduce ourselves, we ask them their full name and their date of birth, and we make sure that the imaging they are having is what is referred to on the slip by their referring physician. We come over here, we pull their name up, confirm again, and we start our exam. When we start in the morning, we do a quick check to make sure that the machine is working properly, that the cords and the probes are intact. We check our Sidex, which we use is Metricide OPA Plus. We check it every morning with the test strips, and then they are recorded on a log. We initial it with our initials. The Metricide is good for 14 days. And once the 14 days is up, we use Glued Out, which is a neutralizer. We pour that in here, let that wait 15-20 minutes. Then we can flush it down the sink. We rinse out the container, and then we refill it with the OPA Plus gallon. Once this is opened, it's good for 75 days, which is recorded on the jug itself. We use gloves, goggles, when we pour this into the container. Once we're done with the endo-vag probe, which we do use a probe cover, we take that off when the exam is done. We wipe off the excess gel, put it into the Metricide. It has to stay in there a minimum of 10 minutes. When it's done, we rinse it out under the water and then let it soak in this container of water for at least 3 minutes. When that's done, we wipe it off, and the probe is put back in its holder on the side of the machine. The other probes are cleaned after every patient. We use the wipes that are recommended by the Siemens manufacturer, which is the Santa Claus gray tops.
Hi, I'm Liz. I'm the lead MRI technologist here at XRA Medical Imaging. Before we enter our Zone 3 suite, I would like to show everybody that we have this MRI safe stretcher here located outside the room for patients that need it. Here is Zone 3 with our electric keypad for only certain personnel. Take you right into Zone 3 here. So this is Zone 3. Here we have our ACR plaques up. And this is where we would scan. Again, Zone 3. We have our, how we power up the machine. We have our emergency stop button. And then I'll walk you guys over to Zone 4, which would be the scan room. And here's Zone 4, which would be the scan room, which the patient would be in. Open that door up so you can take a peek. We have a 1.5 Magna Spree, 1.5 Tesla. I just wanted to point out here, this is our emergency button. If we have an emergency with a patient, we would hit this button and somebody would come running in here for assistance within a few seconds.
Boom. I first need you to spell your last name for me
SOUSA,
and your date of birth.
11/14/1972.
Okay. So I'm Lenore. I'm a senior CT tech here, and I'm going to be doing your exam with contrast today. Have you ever had that contrast before for a CAT scan?
Yes, I have.
Okay. Did you have any problems with the contrast?
No, I did not.
Okay. You'll just get a warm sensation throughout your body, and it may give you the feeling of urinating when it gets to your bladder. Okay. Any allergies to anything?
No.
Okay. Any major medical problems in your history? Diabetes, cancer, heart disease?
No.
Okay. And what are your symptoms today?
I'm having stomach issues.
Okay, such as? Are you having nausea, vomiting, fever?
Yes.
Okay. Any bowel changes?
No.
Okay. And can you tell me about any surgeries that you've had in the area we're scanning today?
Actually, none.
No surgeries.
No
Okay.
surgeries.
Did you ever smoke cigarettes in your lifetime?
No.
Never.
No.
Okay. All right. So, and have you had any previous imaging done on this same area?
Yes, I have.
Okay. And did you bring that with you today?
Yes, I did.
Oh, very good. Then we can be able to compare today's exam to that one.
Thank you.
All right. So we're ready to get started. Do you have any questions?
No, I don't.
Okay. So when you're ready, you can lie down on your back, and we'll get the IV set up. Ready to keep going? Tell me when this- Alright, so I'm just going to take a look for a nice thing here for your IV. Looks like we have a good one. So just hold still. Alright, so now I'm going to have you bring your arms up over your head. And the only thing that you need to do for this is hold still and listen for the breathing instructions, okay?
Okay.
I'm going to take a couple of pictures first, and then I'll come in the room to inject the contrast. And I'll be with you during the injection, and then I'll step out and do the scan. So now we're all done with the exam. You can bring down your arms. How are you feeling?
Good.
Good. You're not having any itching or anything happening like that?
No.
Okay, very good. You did great today. I'm going to take out the IV. Your doctor will get results back to you within 48 hours. And today, drink plenty of fluids, okay? Because that's how you're going to get this contrast out of your system. You won't see or feel anything different. You can eat and drink like you normally do, just increase your fluids.
Okay.
And you're all set to go.
Thank you.
You're welcome. You have a nice day.
Thanks.
When you wait here. So if my patient were to have had a reaction from the contrast, we would immediately call the doctor that's here on staff to come up and assess the patient. If it becomes a real emergency, we have a button on the wall over here that we would push, and everybody that is available in the facility would come up here and help us out with the situation, and someone would call 911. And then if you come over here to the back of the room, this right here is our emergency medical cart in case we need it. We have oxygen available for the patient. We also have an automatic defibrillator here as well. And blood pressure cuffs, first aid kits, stethoscopes. And then in this box here, we have all our emergency medical medications that the doctor might need to treat the patient. The most common ones that we use here are oral Benadryl or IV Benadryl, but we also have an EpiPen available and several other medications. And every month this cart has a quality assurance check where we have to lock the box and put an ID tag on it and make sure that no one has changed the ID tag within the past month. And also make sure that all of the drugs are available and that they are not expired. We also have instructions up here for any radiologist that will come to a patient's aid, and it just gives us examples of what we would do per reaction that the patient might be having.